Before we begin, I want to make one important clarification. In this study, nearly all of the associations between personality variables and abuse or coercive control were weak, even when they were statistically significant. That's important. It means that abuse and coercive control are not well explained by personality alone. Pathological narcissism was not meaningfully associated with abuse and was only weakly related to controlling behavior. And overall personality dysfunction, regardless of narcissism, showed slightly stronger relationships, but those were still mostly weak. The takeaway is that abuse is caused by many different factors. Personality may contribute a little bit, but it's not a good causal explanation, and treating it as one fuels stigma rather than understanding. All right. Welcome, everybody. Happy New Year. This is our first seminar series meeting of the new year. I'm Dr. Mark Ettensohn. I'm joined by my two associates, Dr. Deanna Young and Mr. Danté Spencer. Although, give us an update on the dissertation, Danté.
Dissertation was approved by all three committee members, so I'm happy about that. And I'm finishing up the copywritten editing phase, which in order for something to be published, it has to go through this copywriter, make sure everything is perfect. So that's where it's at now, and then just awaiting a date for my oral defense. So just to be a date where we're all available to do the defense. So that's what I'm waiting. So I'm hopefully in the next couple of weeks, I'm hoping.
Down to the nitty-gritty.
Yeah.
Very exciting. Well, congratulations on having your dissertation approved by your committee. For those who may be watching at home who aren't aware of this process or the details of the dissertation process, Danté's basically there. This means that his committee has accepted the final draft of his dissertation. They do not have any substantial feedback or recommended edits at this point. And the next and last step is really just for him to sit in front of his committee and defend his work.
Yeah.
All right. Very exciting. Well, today, and this is partly in response to some viewer feedback. Folks have been asking about the concept of coercive control in particular, but there was another comment on one of the channel's more recent videos where somebody just asked the question, like, well, why don't you guys take a look at the empirical relationship between pathological narcissism and abuse, right? A lot of the stuff that I've been talking about recently is kind of focused in on the narcissistic abuse or narc abuse content ecosystem online, where narcissism and abuse are pretty consistently conflated with one another. Narcissism is seen as a disorder that sort of inevitably leads to abuse of some kind for a lot of people. They're pretty they're either confused or they think that I'm, like incredibly misinformed when I say things like, narcissism is not a fancy word for abuse and not all narcissism leads to abuse. That these are two separate concepts and they're not the same thing. So I thought it was a great idea. I thought, yep, let's look at some of the empirical data concerning narcissism and abuse. So as per usual, I'm going to read my little summary here of the article, and then we'll get into it. Today's article looks, well, actually, let me start off by telling you the title of the article. Today's article is called Coercive Control and Intimate Partner Violence, Relationship with Personality Disorder Severity and Pathological Narcissism. It is by Day et al. It appeared in the journal Personality and Mental Health. It is from, let's see, it was published in August of 2025, I believe. So this is a very recent article. This is hot off the press. It looks at coercive control and intimate partner violence in relationships that involve people with strong narcissistic traits. The main question that the authors ask is a simple one. Is abusive or controlling behavior better explained by narcissism itself or by how severely a person's personality is impaired overall? To study this, the researchers surveyed people who had been in long-term relationships with someone that they experience as highly narcissistic. Most often, this was a romantic partner, but also sometimes a family member. The participants reported on the kinds of abuse and controlling behaviors that they experienced using standardized measures, and also rated how their partner or relative functioned emotionally, interpersonally, and behaviorally, again, using a standardized measure that's based on the ICD-11 dimensional personality descriptions. And we'll talk a little bit more about what that means. One of the most important findings is that higher narcissistic traits by themselves were only weakly related to controlling behavior, and they were not significantly related to abuse. In contrast, overall severity of personality problems showed a much stronger relationship with both coercive control and intimate partner violence. In practical terms, this means that among people who already show high narcissistic traits, it isn't simply more narcissism that predicts harm. What matters more is how impaired the person is in areas like identity stability, emotional regulation, empathy, impulse control, and the capacity to take responsibility for harm done to other people. The study also found that certain narcissistic features were more relevant than others when it comes to abuse. Traits like exploitative behavior, fantasies of superiority, and intense rage when feeling entitled or challenged were more closely linked to controlling behavior and, in some cases, abuse. Other narcissistic traits showed little or no connection whatsoever. Overall, the authors argue that focusing only on narcissism can miss the bigger picture. Their findings suggest that the severity of a person's personality dysfunction may be a more meaningful indicator of risk for coercive control and violence than narcissism alone. And clinically, the takeaway, according to the authors, is that understanding and treating personality level impairments, not just narcissistic traits or abusive behaviors in isolation, may be essential when trying to reduce coercive control and relationship violence. Okay, so that's what I've got. Let's get into it. What do you guys think?
Yeah, maybe we can first define or delineate the difference between violence and coercive control for everyone.
Sure.
If you're here, I wrote down the violence is the episodic acts like physical, sexual, or psychological, whereas the coercive control, which the article's talking about, is like chronic domination,
Mhm.
economic restriction, intimidation, isolation, emotional regulation of the partner. So it's really a difference. One's really trying to control the other person for a specific reason. The other one is just like violent acts or psychological violent acts.
Yeah. Yeah. Physical, sexual, psychological. Those are the three categories of abuse. And they used two different measures, right? They used one measure. Let's see, I've got them here if I can find them here. Let's see, the composite abuse scale was used, and that's from published in 2016. That was used to isolate abuse. And then the scale that they used for coercive control was, I lost the page. Oh no. Oh no.
See if I can.
Yeah, maybe somebody else can find it because this thing is going
Coercive.
nuts on me. Oh, I got it. The controlling behavior scale. A 24-item measure designed to assess the behaviors perpetrated in the context of abuse or coercive control. Captures 5 domains of controlling behavior. I think these are what you said: economic control, threatening control, intimidating, emotional control, and isolating control. So that was how they separated out these two, what do you call them? Constructs. Yeah. And then they measured narcissism using the brief version of the pathological narcissism inventory. That's also a measure that we use in our practice. And they did something interesting that it does have a precedent in the literature. They had the relatives or partners of the supposed narcissistic person fill this out on their behalf. So this is a key distinction, right? Because oftentimes, um, you know, research that looks at the relationship between pathological narcissism and abuse, and it doesn't find a strong relationship, people say, "Oh, well, of course, because people, they're like not reporting their own narcissism, right?" That's not what happened here. For this, they recruited people from Facebook groups that are for victims of narcissistic abuse. They said, okay, you fill out these measures. One of them was the brief pathological narcissism inventory about the person who you are saying is narcissistic. So if anything, these scores are inflated, not deflated, right? The bias here would be potential bias would be that the people who are in these support groups on Facebook would over-report, over-endorse the narcissism in their loved one, as opposed to under-endorse. So, but even then, even with potentially inflated narcissism scores, they still didn't find a significant relationship between overall pathological narcissism and abuse. And the relationship they found between pathological narcissism and coercive control was weak. It was significant, but weak. And I highlighted it here because I feel like it's important. There was a significant positive relationship with informant narcissism scores, total scores, and reported experiences of coercive control. So the correlation coefficient was 0.18. Okay, so that means that roughly 18% of the variance in coercive control can be accounted for by total pathological narcissism scores. So that's considered a weak correlation. It's not considered a strong correlation, but it is a significant one. And it was not significantly correlated with abuse at all. Now, when you start to drill down into the specific subscales, that's when you start to see some correlation. And we can talk about that too. But grandiosity is not itself pathological narcissism, right? Exploitative behavior is not itself pathological narcissism. It can be a component of it, but it's not it itself, because there are lots of people in the world who are not narcissistic, but they exploit other people, right? So when you look at the different scores on the PNI, and you guys know this from doing assessments, you don't just look at like one scale. You have to take the whole thing and how it all fits together when determining whether it's actually describing pathological narcissism as a construct, or just somebody who's grandiose, but they lack all the other facets that would produce the cohesive syndrome of pathological narcissism. I'll stop talking now. What else?
Yeah, it's interesting. What stood out was the specific subcomponents that the article talked about. That are I guess more of indicators that showed up, which was exploitiveness, grandiose fantasy, and entitlement rage. And I guess I was curious, I guess to hear, um, I guess why an individual would use exploitiveness, like within narcissistic personalities, or you said that you can be exploitive but not necessarily be narcissistic, but obviously that goes with it. So I guess I was curious with entitlement rage specifically and exploitiveness, how you see that showing up and why that would relate to more specific significant components that would relate to this.
Yeah, well, that's a great question. I kind of want to look at what those scores were, um, like what the data was exactly. Because I know, because remember, we're talking about two dependent variables, right? One is coercive control, the other is abuse. Um, and so to see which of those variables were impacted by uh, grandiose fantasy, exploitativeness, and entitlement rage. Does anybody have that? Oh, wait, I got it. Okay. Yeah. So okay. So this table, and I'll put it up probably so that people can see it when I post this. This table is looking at abuse and coercive control, and it's looking at those three scales. Actually, it looks at every scale from the PNI, right? So the ones where they found significant correlations were exploitativeness, grandiose fantasy, and entitlement rage. They did not find significant correlations between self-sacrificing self-enhancement. So that's like where somebody does charitable deeds or helps other people because it makes them look good. Hiding the self. So that's when the person tends to conceal their authentic thoughts and feelings, usually due to shame or fear of humiliation. And devaluing. And this one's very interesting, right? So there's a tendency in pathological narcissism for the person to idealize other people, but also to devalue them, right? And this is one way of externalizing internal conflicts about self-worth. There were no significant correlations between devaluing and abuse or coercive control. So devaluing has nothing to do empirically with abuse or coercive control. Exploitativeness overall had a correlation coefficient of 0.19. So that's 19% with abuse and 18% with coercive control. Grandiose fantasy had no overall correlation with abuse, right? But it did have a 0.22 correlation, so that's 22% of the variance in sexual abuse could be accounted for by grandiose fantasy. So, in other words, when somebody's grandiose, they are, according to this, potentially more likely to engage in sex abuse of another person or sexually coercive or abusive behavior toward them. And entitlement rage had a 0.19 correlation with abuse. So, and then it breaks it all down in a more granular way because abuse again it consists of psychological, physical, and sexual, and coercive control consists of 5 different subdomains: economic, threatening, intimidating, emotional, isolating. So for exploitativeness, it was significantly correlated with psychological abuse, but not physical and sexual abuse. And it was significantly correlated with overall coercive control and threatening behavior or intimidating behavior, but not economic, emotional, or isolating coercion. What was your question again, Dante?
That's all over the place. Well, so the study's saying is a study saying that those specific subcomponents that you're talking about, exploitativeness, grandiose fantasy, and entitlement rage, that those are more indicators if one has that correlation with
Yeah.
coercive control.
Well, with
Well, with both.
yeah, to both, although grandiosity is not correlated significantly with overall abuse, but it is correlated significantly with sexual abuse.
Interesting.
Yeah.
Interesting.
Yeah. So, I mean, we could talk a little bit because I think what your question was like, well, why these 3 components of pathological narcissism? Why are they correlated with abuse and coercive control when the other ones aren't? I think that
Yeah.
was what you would ask.
Yeah.
Well, Does
Yeah,
anybody
let's start
have?
with the
Yeah,
exploitativeness. And maybe you described potentially somebody being you know exploitative and not necessarily having narcissism. So maybe we can discuss how that may show up in like real life or in a relationship.
yeah, yeah. Well, I don't have the specific questions. Oh no, I do have the specific questions, but I don't have them in front of me for what goes into the exploitativeness scale on the PNI, because that might matter a little bit, right?
Mm,
What are the specific aspects of exploitativeness that the PNI is measuring, right?
okay.
But overall, the exploitativeness scale measures a tendency for somebody to relate to other people in ways that are, taking advantage of them, that are using them, um, you know, that are exploiting them, right? Um, there are lots of ways I think that a person can exploit another person without it necessarily having to be related to pathological narcissism, which again, pathological narcissism is a dysregulated system of self-esteem, right? That's that, and it tends to have these different components, right? If somebody is egocentric and constantly concerned about whether or not they have a viable self-image, whether or not they're worth anything, then one way that they tend to express that interpersonally is by taking advantage of other people, right? Your needs are less important compared to mine because I'm preoccupied with self-worth, right? So this is in another video on empathy. I talked about how, if somebody's feels like they're drowning, they will absolutely step on somebody else's head to try to get air,
Mm, that's a
right?
good analogy. Good analogy.
And so the needs of the other person go out the window in the kind of constant low level panic or crisis of the narcissistic preoccupation with self worth.
Uh, Right. And that, it's interesting because it so presents, the other way where it would seem like the person who's doing that
Mm-hmm.
has the highest self-esteem and is just trying to just
Mm-hmm.
just railroad everything and everyone based because they feel so good and so confident and have such high self-esteem when it's really actually the opposite.
Well, I think sometimes it can present very convincingly, like you say, even to the person themselves, right? These are
Mm.
not necessarily conscious conflicts.
That's the part that I was really curious about and what the authors like pointed to for future research, which I'd be interested in, is like looking at all the other different personality styles and how that kind of matches up. Because the exploitativeness, the grandiose fantasy, and the entitlement rage really reminds me of like a toddler, and I feel like it's I don't know, maybe representative of like the early developmental trauma that happens in personality disorder development. And if that's kind of pointing to the author's main point of like personality dysfunction, and if the pieces in narcissism of exploitativeness, grandiose fantasy, and entitlement rage is more like a representation of general personality dysfunction, and if maybe like you study this for OCPD, you might find similar like similar facets of the same construct.
That's a very interesting idea, Deanna, because I think what you're saying is there might be components of these three subscales, exploitativeness, grandiose fantasy, and entitlement rates, that actually tap into personality disorder severity and not necessarily the style of narcissistic personality.
Mm-hmm.
Is that
Mm-hmm.
what you're saying? It's
Yeah.
you know what I hear that as? It's sort of like if we thought about like a physical illness,
Mm-hmm.
like okay, every time you get the flu, you have a fever, but you also get a fever from a bacterial infection and from a this and a that, right?
Right.
And so even though fever is a symptom of flu, and a test of, if we were testing flu without lab tests, but instead by like criteria, like psychology does, then then fever would be an item on the test, right?
Yes.
But what fever is actually tapping into there is how ill the person is, like how much immune response is happening.
Yes. Right.
Yeah.
Mm-hmm.
So and it would actually be like a cross index like feature. It's like you like flu shows up with illness in general, not just I'm sorry, fever shows up with illness in general, not just flu.
Yeah, that's a really good analogy. Yeah, that's kind of what I was thinking of, which is what
Yeah.
I'd be interested to see how that happens like across other styles.
One of the things that they talk about as a limitation to this study is that they did not include other personality styles. They only included pathological narcissism, so they can't make the very comparisons that I think you're asking about.
Mm-hmm.
But would you mind, just for folks at home who maybe don't know these distinctions, would you mind just maybe saying a little bit about what you mean by personality style and overall personality dysfunction? Because I think for some people those are the same thing, and that's not how this study is looking at it.
Oh, yes. I really like the way that you describe it with the hue and the color.
Hmm.
So the color, and I might butcher this, but the color is like the style, and there's a ton of styles. Narcissistic, depressive, avoidant. Um, and then the hue is the levels of health or the levels of organization. And there's healthy, neurotic, borderline, and psychotic. And so that dictates the health of the personality or the organization of it and how healthy the person is or how dysfunctional the person's personality is. And then the styles are like the different colors. And they're different. There's like 15, I think.
It depends on where you're looking, but
Okay.
yeah, like the DSM personality disorders, those are really different personality styles, right? And although the DSM doesn't look at it this way, but it's starting to move in that direction. So what we're really talking about is the difference between a categorical and a dimensional way of thinking about personality, right? The categorical way, like you said, you have different hues. You have red, green, blue, right? Red is narcissistic, green is paranoid, blue is obsessive compulsive. The DSM tends to treat those as though each one is its own discrete disorder. But the way that the world of psychology is going, and the ICD, the international model, is already there, treats it dimensionally. So instead of each of those being a separate personality disorder, what they really are different flavors of ice cream, right? They're all ice cream, but they have different flavors. Some have nuts, some are minty, right? But the underlying issue is kind of the same, and that's personality disorder. And personality disorder has things in common, right? And like I said in the kind of synopsis, things like identity disturbance, emotional dysregulation, interpersonal disconstraint, or interpersonally maladaptive behaviors, right? And depending on which model you're looking at it from, if it's psychoanalytic versus a different model, the psychoanalytic model would be that ego functions are impaired. The person is having a hard time tolerating distress when it comes up. They're having a hard time maintaining a realistic and consistent view of reality in the face of emotional threat and turmoil. And they do not have adaptive coping skills. So they end up doing things like externalizing, splitting, projecting, denying, stuff that ends up creating more problems rather than solving the problems that they have. But that's what this article is looking at, right? They're saying, hey, look, is it the flavor of ice cream that causes abuse? Or is it the fact that or is it ice cream itself, right? The analogy breaks down here, but is it specifically the narcissistic version of personality disorder that causes abuse, or is it personality disorder? And what they found is it's personality disorder. The more severe the personality dysfunction, the higher the correlation with abuse and coercive control.
So it's like the stronger the flavor of that particular ice cream is, the more severity of the features that you see, like either abuse or coercive control.
Yeah, because the person just can't tolerate relatedness. The more severe the personality disorder, the less able they are to deal with other psychologies. They can't negotiate their own psychology. They can't it's especially in situations where there's a lot of emotional distress or stress, like intimate relationships can be. So let's talk a little bit about the measure that they used for personality severity itself. They used something called the Personality Disorder Severity Scale, published in 2021. It measures core elements of personality functioning: self-functioning, interpersonal functioning, emotional, cognitive, and behavioral manifestations, harm to self and others, and global impairment. I found an image of what the different levels of personality dysfunction look like on that scale. And I'll try to put that up so people can see it as well. So that's the intensity of the flavor, right? In other words, because it's possible to have pathological narcissism, like to score, in the significant range on the PNI and not have a personality disorder. We find that in our assessments. The person is functioning okay. They have core conflicts concerning self-worth and self-esteem, but we wouldn't say they have NPD, right?
So there's a lot of traits, but it's not severe enough to be so disordered.
Yeah. Although traits, it's confusing language again, because some people consider there's something called trait narcissism, and that's like what folks like Peter Salerno in particular is defining pathological narcissism as trait narcissism, which is not the same thing as pathological narcissism, and it causes all kinds of confusion because trait narcissism is like, are you grandiose? Do you have low empathy? Like, and that's not a syndrome in the way that contemporary clinical models consider pathological narcissism to be.
Because that's more of a constellation than like a categorical trait-based understanding.
Well, because trait narcissism, it's defined by like the big five, like the big five model. So it's defined as, and I might get this wrong because I'm just pulling it right out of the dark corner of my memory right now, but something like low agreeableness and high antagonism. Right. So those are traits that do have high or moderate heritable components. But just because somebody meets those criteria does not mean that they have pathological narcissism. It doesn't mean they have a preoccupation with self-worth and self-esteem that manifests in the ways that the PNI assesses, or that they have the characteristic pattern of impairments that we would say uh, uh, constitutes a personality disorder.
Mm-hmm.
Yeah, and I think
Issues with identity and stuff like that.
yeah, I think it's important, Mark, to distinguish that because I think that um, uh, oftentimes we don't have the full understanding of the diagnosis is not being diagnosed based on their traits or their their behaviors, but really the organization, how the personality was organized, early on, that developed that particular wiring for the personality disorder,
Yeah.
versus just having certain characteristics that are similar.
Yeah, yeah. I think somebody could have high levels of trait narcissism and not have NPD, in other words, or pathological narcissism. But the way that you were using traits, which is also a valid use, by the way. So this is where like the language gets cuckoo, right? The way you were using traits, Danté, is like as specific components,
Mm-hmm.
grandiosity as a trait, uh,
Mm-hmm.
contingent self-esteem as a trait, right? So in other words, the building blocks of pathological narcissism, but they just don't build a structure that's tall enough to qualify, you know, in other words. Got a lot of mixed metaphors going. Yeah.
Yeah, that makes it hard to like treat, but which I think is really interesting that this article points to the general personality functioning, because you can really cut through all the noise and just kind of get to like treatment that's really focused on the core issue.
Yes. And to that end, actually, let's take a look at the actual correlations between overall personality functioning and these different things. So table 5 looks at the associations between those different dimensions of personality functioning: self-functioning, interpersonal functioning, reality testing, harm to self, harm to others, global impairment, and emotional behavioral control, and abuse and coercive control. And pretty much everything is correlated significantly. There are some exceptions. Sexual abuse is not correlated with anything except harm to others. Harm to self is only correlated with isolating coercive control. So when somebody, in other words, if somebody is self-harming, and that's a big thing, there is a 0.18 correlation with a form of interpersonal manipulation or control that tends to isolate the other person.
Like I'm self-harming to get a reaction or to control.
Yeah, but that could be one of the things. It could be like I don't want you to leave and go see your friends. I'm going to cut myself or hurt myself. It could be I'm super envious of your life outside of our relationship, and I have severe abandonment anxiety, and so I'm going to self-harm if you seem to have other forms of social engagement. Yeah. The one, harm to others was correlated with everything, of course, because that's by definition, if you're harming other people, you're abusing them or coercing them. Yeah. So basically what this is saying is the more severe the personality disorder, the higher the likelihood that the person is engaging in some form of abusive behavior toward others and coercive control in their close, intimate relationships.
Yeah, and I think that overall, this is good to see that, just because somebody has either a diagnosis or has these deemed, pathological narcissist or have NPD, that it doesn't necessarily correlate with that they're going to be abusive. It's the severity of it, or any personality disorder for that matter.
That's the key. That to me is a very important take home point. And it's not, look, I mean, it's not to exonerate like people who have pathological narcissism, because if somebody has, like you just said, a severe enough personality disorder, they might, there is a higher likelihood they're engaging in abusive or coercion, right? Um, and there was weak correlation between some facets of pathological narcissism and some facets of abuse and emotional coercion, right? So, it's that relationship is there, although again, it's weak, and it's consistently weak too. By the way, the authors in their lit review talk about how, well, across multiple studies now, pathological narcissism is only ever weakly associated with abusive behavior, if it's associated at all. But the critique of that was, well, people are minimizing their own narcissism, right? And so to solve that problem now, they've asked the person's spouse, right? In other words, or their partner. There were also family members, like some people had a family member, but it was 71% was a partner or a spouse. 16% was the mother. My mother was narcissistic, in other words. And by the way, in case people think that these are like fleeting relationships or something, the mean length in years for the relationship was 20.
20, yeah.
So these are long-term enduring relationships. Most of them were women reporting on men, like the majority. 63% of the narcissists in question were male, and 86% of the people reporting were women.
But most of the relationships were reporting about their mother?
No, most of the relationships were women in heterosexual relationships reporting on men.
Okay. And then for the family members, it was
16% was the mother. It was the mother who was the narcissist. Yeah.
Oh, I see. Okay.
Which is interesting.
Yeah, that is interesting.
Yeah. Only 1.5% was the father. I wonder if I'm reading that wrong. I wonder if that's the person reporting. Yeah. Well, I don't know. It's ambiguous here, the way that it's listed in the table. So,
I think this points to a larger thing within our practice. When we do assessments, it's not just the assessment of the person and the self-reported, but we do a collateral interview where we actually interview the family member or the partner, to talk about the individual, because obviously there's blind spots, and the personality disorders are mostly egocentric, so they're not aware of certain things that are happening in the personality. So we do really have a full diagnostic interview with the loved ones, so we really kind of get the person's behavior and how they are, how they have been, to get a full I guess, understanding of the individual. So I like how we do that in this assessment, rather than just working with the individual.
Yeah, when we can. We can't always. It's not always. There isn't always a person to interview, but when we can, yeah, we do a collateral interview to get that third-party perspective. We also, one of the reasons why we use the main personality instrument that we use, which isn't the PNI, by the way. We don't. The main thing we use to assess narcissism is not the pathological narcissism inventory. That's a supplement, because it's not validated as a clinical measure. It's validated as like a research measure. So we use that, but that's not the main thing. The main thing we use actually is where we, as the clinician, use the like 6 or 7 hours of clinical interview data that we have, plus our clinical impression over the span of those weeks where we did the interview, to complete a personality profile ourselves using a validated measure. So in other words, it's not like an MMPI where the person themselves is rating their own personality attributes, right? It's we using what they've told us in combination with our clinical impression are the ones rating those things using a different measure. And that gets around that demand characteristic bias that could otherwise show up where the person's faking good,
Yeah.
kind of thing. Because, I mean, it's one thing for somebody to fake good or whatever across like a 3-hour interview one afternoon. It's another thing for them to do it across 2 months of interviewing when we also have the report of their loved one and we're specialists in assessing pathological narcissism. You know what I mean? So it's like, there are ways that it's baked into our process as well to try to make sure that we're accounting for demand characteristics, which is the research term for somebody kind of faking good.
I like that the main measure we use is also so comprehensive of personality, and it's not just like a yes or no, you have narcissism, but it really details like kind of everything.
We get a DSM profile. We get a separate sort of proprietary personality profile that's more clinically informed. We get a trait profile. Plus, we screen for dissociation, PTSD, bipolar disorder, depressive disorders, anxiety disorders, ADHD, and then plus the substantial clinical interview, which is their entire history and all of their significant relationships, and
Yeah.
So I mean, long story short, if you're sitting at home and you're interested in getting a full psychological assessment that does far more than just look for narcissism, and you want to do it at a price point you're not going to find anywhere else, literally, give us a call because Danté and Deanna are available to do some assessments.
And they're pretty therapeutic, I would say. I've had a lot of folks say, oh, this is like really good to just kind of be interviewed in such an in-depth way and reflect on experiences, be asked really in-depth questions.
Yeah.
I really appreciate that part about it.
Yeah, I was really impressed because, like the assessment there's assessment where you're focusing on what we were just talking about, and then there's just your normal, sessions. And I found that the normal sessions, which you're actually working on stuff, it's not enough. Like I found so much more information doing this assessment and asking these specific in-depth questions about their life that I don't think would have naturally or organically come up in conversation if we were just doing, our normal therapy. So it was very, and I think the person gets to really see their whole life and how stuff came about and why stuff came about. And I think they are able to really get help just from seeing this timeline and this development in their life with every relationship.
Yeah. Which is important, right? Because a lot of the time, I think psychological assessment, and this is, for like efficiency's sake or whatever, it's really become like you either do or you don't have this disorder or that disorder. It's just a way of sorting people into categories. But we're really interested in understanding how personality functions. And so we're not just sorting people into categories. It's trying to construct a through line across the arc of the person's life. It's really a character study in a way. How is it that these particular ways of defending the self or negotiating experience, these particular symptoms came to pass? how were they functional in the early environment? How are they continuing or to function or not function now in the context of adult relationships? What would we call them? That's the diagnosis part, right? But the diagnosis piece is like 1 page and the report's like 25 pages, so it's a very in-depth process. But one, I think that that articles like this are really pointing to the importance of, you know, like just to know whether or not somebody has pathological narcissism. Okay, that's helpful. But what's really helpful is to understand the, is it severe? Is it moderate? What are the contextual aspects of that? Because people's pathologies, they show up in different settings depending on what the demands of the environment are. Right? Mm-hmm. A lot of the folks that we assess do quite well in a professional environment because of false self aspects of NPD, right? Where there's a narrow range of functioning where they do quite well, and it's non-conflicted, that little range, right? This is who I am. This is what I do, right? Identity is cohesive within that range. Outside of it, it's stormy seas, and that's kind of what this article is talking about.
Yeah.
The stormier the sea, the more likely there's some kind of problem happening in their relationships that shows up in the form of manipulation or abuse or coercion. Yeah, but that would be, again, that would be true, I think, at least according to this data, that would probably be true with any personality disorder. So the take-home point is, when people say that narcissism leads to abuse or causes abuse, or there's no way for a narcissist to not abuse, they're collapsing many different distinct concepts into just one soupy, ambiguous statement there. That's just filled with stigma, it's totally possible, and this study demonstrates that, to have a high level of pathological narcissism as endorsed by the people who are in your life, and also not be engaged in abusive behavior.
Yeah. Good.
Yeah. All right, guys. Well, we've reached our time. Thanks so much for joining again. And for everybody at home, if you're in California and you're interested in psychotherapy for identity issues, pathological narcissism, NPD, or anything related, or you want to get an assessment for that, give us a call.